PCA. So I've also checked that it's both signed. This is signed by the transcriber and nurse. So I did my 5 rights, that's correct. I'll just put this aside. Now I'm just gonna look over my PDM here. So I have morphine sulfate, it's an opiate analgesic. It's a high alert medication, so I'll make sure that I have a second nurse do an independent check. As a student nurse, I am allowed to give this medication. So I'm giving this via PCA, and it says refer to the WRH8 preprinted physician's order, which I did, and I know that both my PCA dose and lockout interval is within the range. And it says here, reconstitution for PCA, see page 4 for my rate and calculation. So I'll do that. So just looking through. Okay, so looking at the compatibility, it's compatible with D5W, normal saline, dextrose saline. I'm going to use normal saline. And then going over my potential hazards, there's respiratory depression, shortness of breath, dizziness, confusion. I'll go over that, also make sure that I know so I can educate my patient on what to look for if anything happens. And then additional notes, I'll be monitoring for pain relief, respiratory and mental status, and blood pressure, so I'll take his vital signs. Okay. Again, we're doing this via PCA. So I know it's morphine 1 mg per ml, final concentration 1 mg per ml. So this is my recipe right here. I'm gonna drop 50 mg from 5 10 mg per ml vials, which I have here. And I'm going to need 45 ml of normal saline. So I have my 50 ml bag here. I've also checked to make sure that it's safe to use this bag, and it is. Final volume is going to be 50 ml, and my final concentration is 1 mg per ml. So at this time, I'm just gonna go ahead and do my first check. So starting off with my right patient is Marcy Paris. Right drug is morphine 1 mg per ml. Morphine sulfate. I have morphine, 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 and morphine.
I just want to hold that up. I'll look at concentration here. Do you want to just hold it up to the camera?
Oh, sorry.
There you go. Great.
Okay. And right dose is PCA dose of 1 mg. So looking at this, because it's 1 mg per ml, final concentration is 1 mg per ml. I have my 5 vials, so I'm going to drop 50 mg for my 5 vials, which is going to be 5 of the 10 mg per ml. So I have here 10 mg per ml, 10 mg per ml, 10 mg per ml, 10 mg per ml, and my 10 mg per ml. I'm going to add this to my 45 ml of normal saline. So I'm going to take out 5 mLs. Final volume is going to be 50, and again, my final concentration is going to be 1 mg per ml. So my right route is going to be IV PCA. I'm looking at my PCA PDM here. Right lockout interval is 5 minutes, and it's within range. And right time is today now. I've also stated and looked that there is no continuous infusion, both on the physician's order and on my MR. Okay, so now I'm just going to wash my hands and get my things ready. I'm just going to set this aside here. So I'm going to clean this for 30 seconds, dry for 15, but for the sake of demo, time has already passed. So I would just throw this away in reality. And again, I'm going to be taking out 5 mLs. Okay, being careful not to contaminate or puncture my bag. I want to make sure that I have no bubbles in here so that I have the accurate right amount. Okay, so I have 5. And I'm going to write out my label. So I have 5 ml of normal saline. So I will just add this on here. Now I'm going to pull up my 5 mLs. So in reality, I would use a blunt filter needle, but because it's been used so many times, the filtered is not functioning well, so I'll just use the regular blend fill. Fill this away so I don't need air. Okay, so this is empty. I'll set this aside. Okay, so just over my waistband, I'm just going to pull back, take out any bubbles, and I'm going to calibrate to 5. Okay, so I just have a little extra. So I'm at 5 ml and I see a bleb, there's no bubbles. Okay, so now I'm just gonna write out my label here. So this is for Marcy Paris. Drug is morphine. Dose is going to be 50 mg. Volume is 5 ml. There's no diluent. Concentration. Time is November 27, 20, 1100. And then BT, UMS, and 3. I'll add this on here, and I'm gonna make my final label. My patient, Marcy Paris, drug, morphine. Dose is 50 mg, volume 5 ml. My diluent is going to be 45 ml of normal saline, which will give me a total of 50 ml total. My concentration is going to be 1 mg per ml. Date, November 27, 2020, 1100, and then BT, UMSN 3. And then here, I have my PCA. Dose of 1 mg. Then my lockout of 5 minutes. And then no continuous infusion. So I'll put that on here. Now I'm just going to go ahead and do my check again. So I have here, right, patient is Marcy Paris, Marcy Paris, Marcy Paris. Right drug is morphine, 1 mg. So I have morphine, morphine. I'm looking at my morphine PDM. I have morphine, 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 and morphine. My PCA dose is going to be 1 mg. So I have my PCA dose, 1 mg. For my PDM, I'm going to need a total of 50 mg. 50 mg, which is 5 mLs. 5 mLs here, 5 mLs here. I'm also looking 5 mLs. And I'm going to add this into my 45 ml of normal saline. I have normal saline. I took out 5 ml of normal saline, as it says here. I'm seeing it. So I have 45 in here. And I'm also looking 5 mLs, 45 in normal saline. Final volume is going to be 50 ml. I have a total of 50 mLs once I add it all together. Final concentration is 1 mg per ml. And I have here 1 mg per ml, and it's morphine 1 mg per ml. Again, so I'm just looking at my 5 vials, so I'm going to double check. It's 10 mg per ml, 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 and 10 mg per ml. Okay, so lockout of 5 minutes. I have my lockout of 5 minutes. There's no continuous infusion, no continuous infusion. Right route is IV PCA. So I have my IV medications here and looking at my IV PCA PDM. Right time is today now. Have here today now, today now. So I did my checks. At this time, I'm gonna have my second nurse come in, do an independent check, and I'll also make sure that she signs my final label. She says everything is good. So I will go ahead, put this into the sharps. Oops. I'll clean this first. I'll clean for 30 seconds, dry for 15. I'll insert this in. Put this into the sharps. Give this a good mix. I will add my final label on. So these are all empty. I'll put this into the sharps. Make sure everything is clean. And now I'm gonna go to my patient's room. So upon entering my patient's room, I'm doing a quick safety check. Call bells and reach. Patients don't get stressed by the lowest position. Hi, my name is Bethany Thomas. I'm a student nurse here, and I'm here to give you the morphine for the pain that I've already assessed. Is it okay if I just verify that you're my correct patient? So as he's verbalizing, I'm just gonna look at his the wristband. So Paris Marcy, Paris Marcy, Paris Marcy, Marcy Paris. And your age, 55 years old, 55 years old. Do you have any allergies at all? No allergies, good. VIN number 123456789. VIN number 123456789. So I'm giving you morphine for the pain that you have been complaining about. With this, we're gonna be putting it through the IV PCA. So you have your button here. Once you hit your button, you're gonna get 1 mg of the morphine. We have something called a lockout interval. So once you hit the button, you have to wait 5 minutes before you could have your next dose. That's just to make sure that you don't have too much of the medication in your system. With this as well, there's some signs and symptoms to look out for. So dizziness, drowsiness, trouble breathing. So I will be coming in to just reassess your pain. I'm also going to take your blood pressure now, and I'll be monitoring to see how you're doing. Do you understand how to use this machine? Yes. And is it okay if I give you this medication? Yes. Okay, great. Just gonna now do my third check. So I have here Marcy Paris, Marcy Paris, Marcy Paris. VIN number 123456789. VIN number 123456789. He's 55 years old, 55 years old. The right drug is morphine, 1 mg. Morphine, concentration 1 mg per ml. 1 mg per ml here. PCA dose is 1 mg. PCA dose, 1 mg is PCA. Lock-in interval is 5 minutes. Lockout 5 minutes. There's no continuous infusion. No continuous infusion. Right route is IV PCA. I have my PCA mini bag and my pump here. And right time is today now. Right time is today now. I'm also just inspecting the site, making sure it's dry, intact, no redness, no swelling. Doing a quick head to toe, making sure that everything is unclamped. So I see that. It's unclamped. And then I'm also looking, and I see that he has a carrier of normal saline running at TKVO. So I know that is compatible with my medication. Okay, so I'm just gonna now set everything up. So I'll turn this on. Just looking at the password. Yes. 9, 4, 6, 2, 9. Okay, so now I'm just gonna look. So I know it says units is mg. I have here mg, mg. So I'll press yes. My concentration in mg per ml. That's 1 mg per ml. 1 mg per ml. We're gonna be giving this through IV, as it says here, IV, and this is my IV PCA mini bag. There's no loading dose, so I'll keep that at 0, just verifying here. And med limits we're gonna keep off as a safety feature. Next, yes. So bag volume, 45 plus 5 is 50 ml. The basal rate, there's no basal rate, and I have that here as well. We're gonna keep that at 0. Patient bolus is going to be PCA of 1 mg, dose 1 mg. And then this is going to be the lockout of 5 minutes, lockout 5 minutes. And then it's 60 divided by 5, so he's gonna have 12 bolus in an hour. So I'll press yes. Am I done? Yes. Before pressing start, I'm gonna have my second nurse come in, review everything independently, and she said everything is good. So I'm now going to set everything up. So I would unlock this. Okay, so this will be empty and I'll just throw this away. Making sure I'm maintaining sterility. I'll insert that in. Making sure my label is visible. So I'll lock it. She said it's okay to start. Everything is right. So I'll press yes. Run, sorry. So I know it's running because I'm seeing some green flashes. I'm also going to just do a quick head to toe, making sure everything is unclamped. Okay, everything is unclamped, is good. I'll make sure my patient has the bell in his hand. Again, if you have any questions or concerns, I'll be coming back to reassess your pain and to see if there's any signs and symptoms. So I'm just going to do a quick exit safety check. He has no questions or concerns. At this time, I'm now going to take my MAR. I'm going to document when I started the infusion, as well as having my second nurse sign off, and just keep in mind the goods and demands. So, yeah.